Hey guys, Dr. Eddy Dona. I want to be talking about a very interesting and somewhat controversial topic, breast implant illness, or BII. I say that because there are many people who believe it exists, and there are also many people who claim it doesn't exist. It's all nonsense. So what is BII? Well, as its name implies, it's an illness that many women with implants are experiencing. Now, however, it's not an easy to define illness. There are many conditions and symptoms associated with it, or that fall under the umbrella of breast implant illness. So many, in fact, I've had to write them down or some of them down. Now, some of the commoner complaints include fatigue and low energy, cognitive dysfunction, brain fog, memory loss, headaches, muscle and joint pain, hair loss, recurring infections, skin rashes, swollen lymph nodes and glands, irritable bowel syndrome, hormonal conditions, autoimmune conditions, etc., etc. There's basically a plethora of symptoms that fall under the umbrella of BII. And there are websites and Facebook pages dedicated to this particular condition. However, no scientific tests exist to show or confirm that an individual is suffering from BII. In simplistic terms, it's basically a diagnosis of exclusion. In other words, a person is suffering from one or more of these symptoms. They undergo tests, or often many tests, to find the underlying cause for it. Nothing is found. In the end, of course, they're still suffering from those symptoms. They have implants, so therefore the implants are considered to be the cause of their problems, breast implant illness. Now, thousands of women worldwide believe they have BII, and many women are having their implants removed in an attempt to cure themselves, and many of those are actually feeling a lot better after it's done. So why do people blame implants on this condition? Why do they believe implants are causing this condition, I should say? Well, implants are a foreign material, of course, and when they go in, the body's natural normal response is to form a scar tissue capsule around it. Like I said, this is a normal response. So believers in BII claim that it is this body's normal or heightened immune response to rid the body of the implant that is one of the main contributing factors to BII. And this seems to be very sensible logic. However, silicone is a very inert product. Whether the implant's silicone or saline, it's still a silicone gel, still a silicone shell. And silicone is used in countless medical products that are inserted in the body and used in the body, of course. The other thing is there are countless foreign materials that are inserted in the body permanently in medicine and in surgery, such as various meshes, various grafts and stents used in vascular surgery, neurosurgery, various metals and glues and bone cements and plastics, etc. All these products which realistically are far more toxic and far more immunoreactive than silicone. Yet to the best of my knowledge, none of these groups of patients have any symptoms similar to the BII group of patients, I should say. And therein lies one of the key issues associated with establishing a diagnosis or disease that is BII. Now, many things are done in medicine and surgery without there being any level 1 evidence to support it as being correct or the best way of doing it. And without getting too technical here, level 1 evidence is basically the highest level of scientific evidence to prove that something is the best way of doing it, or correct, in fact. And that's why you can go to a surgical conference and you get 10 different surgeons get up on stage, and each of them explain 10 different ways to do the very same operation, and each of them believe they are correct in the way they do it, despite the fact that there is there's no level 1 scientific evidence to support that. It's basically their own personal experience that is determining what is the best thing. So you see, we do a lot of things in medicine without any level 1 scientific evidence to support it as being correct or the best way of doing it. Therefore, we should not be dismissing something as not being real just because we don't have any scientific evidence to support it as being real. And that, of course, applies to BII. In the end, who am I, or who is any doctor, to be sitting across from someone who is suffering from BII or all the symptoms associated with BII and say to them, it's all in your head, it's not real? they're obviously suffering, it's real to them, and therefore we have to acknowledge it as being real to them. However, as initially stated, the symptoms of BII are very non-specific. And indeed, if you get a group of, say, 1,000 women with implants and do a survey of all the symptoms they're experiencing, then get another 1,000 women without implants of similar demographics and do a survey of all the symptoms they may be experiencing, you'd find that within both groups of women, there's going to be a sort of equal number of symptoms which all fall under the umbrella of BII. In other words, the symptoms of BII are very non-specific, they're very general, and women with or without implants are going to experience them. And therein lies the second significant problem associated with diagnosing or establishing a diagnosis of BII. In the end, what do we have? We've got a condition where there is no scientific evidence or studies to confirm a person has got it. You've got symptoms that are very non-specific, and women with and without implants are equally suffering from them. And you've got the field of surgery where countless foreign materials are inserted in the body without any of those groups of patients experience any symptoms consistent with those that fall under the BII group. And these are obviously problems associated with establishing the diagnosis of BII and the condition, indeed that condition. However, I'm a specialist plastic surgeon, and pretty much most plastic surgical societies around the world do acknowledge that women with BII exist. They just can't confirm they actually do have it, but they all acknowledge as well that much more research is required. And one day perhaps I'll be able to sit here and say, yes, BII, we have scientific evidence now, and BII is indeed a real thing. But for now, I can't say that, nor can any healthcare professional say that a person has BII, unfortunately. So, where does it leave all those thousands of women who believe they've got BII? Well, as I stated in the beginning, many women are having implants removed to correct the problem or to cure themselves, and many of those are feeling a lot better afterwards. So basically, the only thing that can be offered to those women who firmly believe they have BII is to have the implants removed. However, this is done with the disclaimer that implants will be removed, but there is zero guarantee that the symptoms are going to go away. But if they do, beautiful. But at the very least, if they don't go away, then you've got peace of mind that the implants are now, or you are now implant free. And that's obviously very, very important to those women. In the end, it's a very difficult condition, and one which is hard to, like I said, to diagnose, or impossible to diagnose. And implant removal is the only treatment option, like I said, with that very significant disclaimer that it may not cure the problem. Anyway, I hope you've enjoyed that talk on, like I said, a very difficult and controversial topic. Thank you for listening.